ecosystems. The objective of this digital dialogue is to examine evolving digital health interventions through a health systems lens to better understand and prepare for more inclusive, integrated, and accountable digital health models beyond the pandemic. Today's digital dialogue will focus on matters of scale and integration in digital health ecosystems. Our panelists will discuss lessons for integration of digital health technologies into health services for both scale and sustainability beyond COVID-19. They will explore the role of the government in facilitating a process of digital transformation that supports increasing access to effective and affordable health services by all social groups, as well as the implications for government's role in overseeing digital health transformations in mixed health systems. The format of today's 70-minute session will involve two initial 7 to 8 minute context-setting presentations, followed by comments by Dr. Birger Forsberg, and this will be followed by a more freewheeling discussion. We do encourage audience interaction, so please feel free to ask questions during the session via the Q&A option on your screen. So it is now my pleasure to introduce our very stellar speakers for today's session. We are privileged to have Dr. Dinesh Arora, a public health expert with over 25 years of experience in leading transformational public sector projects in India and Southeast Asia. He's a medical doctor and an officer of the Indian Administrative Service with vast experience in designing and implementing health sector interventions across all levels of administration. Dr. Arora was the former Director, Health Niti Aayog, where he was responsible for health policy, as well as the founder, Deputy CEO of the National Health Authority of India, where he spearheaded the world's largest publicly funded health insurance scheme, the Ayushman Bharat Yojana mission. Dr. Arora is currently pursuing a doctoral degree in health policy from the Johns Hopkins University. Welcome, Dr. Arora. We have next Dr. George Godzadze. He's the president of the Curatio International Foundation, Republic of Georgia, and he brings over 20 years of experience in health policy and health systems research and manages a portfolio of programs being implemented across several countries. Dr. Godzadze is the executive director of Health Systems Global, the first international membership organization dedicated to promoting health systems research and knowledge translation. He's also associate professor of healthcare financing at the International School of Public Health in Tbilisi Medical University, Georgia. Finally, we have Dr. Professor Birger Forsberg. He's a senior physician at Region Stockholm and an associate professor of international health, Department of Global Health at the Karolinska Institute in Stockholm. His experience spans work in more than 25 countries as staff member with WHO, a researcher, and a consultant to various international organizations, including the World Bank, where he has facilitated interactions between public and private sector in health services in various contexts and countries, particularly in South Asia. And finally, my co-moderator and facilitator for the session today evening, Professor Jerry Bloom, who's a fellow at the Institute of Development Studies, University of Sussex, with expertise and interest in the evaluation of mixed health systems and digital health interventions, who will join me in co-facilitating and moderating the session. So welcome again to everyone. And I would now like to call upon Dr. Arora to go ahead and make his presentation.
Thank you, and please allow me to share my screen. Priya, do let me know once you're able to see my screen.
Sure. Yes, I can see your screen, Dinesh. Yeah.
Right. Priya, do make me aware of the time. Right. Thanks.
Sure.
So it's an old saying, you know, and Edward has been saying this, that in God we trust, others should bring data. And I'm a very big fan of data. And that's what I was saying, that when I start my presentation, I should start with saying that Well, we have issues of 1 in 3 adults having multiple chronic disease, but this is something which came as a side effect of COVID, a positive side effect. 75% health consumers expect personalized health experience. And I think this is paving way towards more, personalized diagnostic and treatment for people, more precision-based health. And 40% health consumers believe that they will continue to use telehealth. Again, a wonderful development. And we have issues at hand. And I'm talking here about the experience as a practitioner. These are my personal experiences. These are my personal views. But as a personal experience in LMIC, I believe 42% physicians in India were burnt out because of COVID. 25% of the healthcare expenditure wasted as administrative complexity. And we have a global shortages of skilled healthcare professionals. So there is a need for transforming health service delivery backed by a solid data. These are the players which actually did human service during COVID. And I will talk about this in my next slide when I say that the pathway to digital transformation will hinge upon three major technologies. The first technology is a cloud-based digital platform where all data will be stored. Second will be the Internet of Things, where we can have different physical items giving us data which are connected. And thirdly, when you have so much data, you will require artificial intelligence to deal with. This all is going to make us into a connected ecosystem where devices speak to each other, we get live data, and we can take decisions based on that data. Where are we? Different countries and different states. So some countries have started generating data and processing devices. Some have connected devices. Some people have started already using AI, which is like a smart health system. And maybe some at a very high advanced stage, which have integrated health systems. But we will require different players to come together. Two basic conditions other than these three technologies I mentioned: interoperability, because there will be multiple vendors providing multiple things. But what we will require will be interconnectivity between all the three to have an ecosystem. And the second thing which I mentioned is FHIR, the industrial standards which needs to be followed by all to have an ecosystem which can work. And this system of ecosystem will lead to precision diagnostic. And I'm just keen here to show one thing. We understand the whole life cycle approach, that this has to be backed by a solid informatics layer and an AI system, which could help us in dealing with digital technologies, how digital technologies could actually become a backbone of information and a digital twin, what you call one, on the live, on the wire information, and three, a 360-degree view of the patient, what's happened in the hospital to what happened in the home care and in the transit, everything being recorded. But we have challenges, and the challenges are these seven are, I think, the important challenges. First of all, the regulatory and legal framework. For example, even in India right now, telemedicine is still asking for a legal framework. E-pharmacies, e-prescription have not been made legal, asking for a regulatory framework. Consumers do have concerns about security and privacy. Privacy of data and the security of the data which is being held up by in the digital scheme of things. We do have two kinds of ethical questions, but we believe that yes, the data is owned by the person concerned, by the patient himself or herself, but how that data is being used will remain an important issue, including the usability between a patient and a provider. The crux comes here is that a physician, while is a guardian of a patient, is also an employee of an hospital care, an employer, or if he's a self-entrepreneur. So dichotomy of a role of a physician makes the usability issue a little challenging. We have startups, companies coming up, and we need to have motivations aligned for the public good as well as for the good of the profit making. Well, we have these on the corporate side. One of the important issues will remain for many countries is the digital divide. Whether people can access, have the digital background of the digital literacy issues as well as the infrastructure framework. And of course, what we do not talk about is the gray divide. I have seen in my house, my parents, even they want to put up some TV, Tata Sky or something, they need my help or my kids' help to do that. They have an app downloaded, but they need somebody to operate a smartphone for them. So a gray divide will be equally challenging because this is the segment which also requires a maximum healthcare. And these all issues will need have a solid interoperability issue and fragmented systems. And I can believe, coming from Johns Hopkins, I can tell you how fragmented the US system is, where none of the people speak to each other, the systems. So we do require a system structure for a digital health to go forward. India had built up an Ayushman Bharat digital mission, which perhaps tries to fix many of these things. And depending on the time, I will go into the details, but just wanted to show you that, what happened when I was having, I also suffered COVID and went for a report, and this is from a particular lab, and they sent me a report, and then they said, okay, here's your SMS, download your report. Fair enough. I thought very digital. You don't have to check it. You don't have to call them. But this is not longitudinal health record. I do not know what happened to me previous time, what's happening to me this time. And secondly, it's not standardized. A PDF form, which is not standardized, not read by any other instrument. So I don't have a longitudinal history, a longitudinal record of what happened to me. And that's the challenges in India, which I stem from all these things for the citizens, for the hospital labs, as well as for the stakeholders. So when we are moving towards digitization, these challenges are perhaps true for all the LMSI or low middle income countries to have it. So simple, most important thing is one, have a health ID, and then have all the information coming as a standardized FHIR format, the fast healthcare interoperability resources, which can be interoperable. Two basic conditions actually to move forward. And this is what the Ayushman Bharat brings it to answer all these queries, which have to have a health record. It talks about generating a public health facilities compliant and speaking to each other, what we call as ADB-DHM compliant, all health programs to be brought into this in the time being, and of having a unified health interference, like booking appointments, ordering appointment, or getting an ambulance reserved, or buying medicines, all through one ID. If there's one slide which I wanted to show for the Ayushman Bharat health mission, that is this slide, the important key components. What do you need to have some kind of a basic foundational system to work? Health IDs for a seamless flow, the registry of the doctors, nurses, physiotherapists, all the staff involved. So what called the healthcare professional registry, a registry of a health facility, like which hospital it's being given or which diagnostic center it is being given. This leading to some kind of personal health records and electronic health records, the whole hospital talking to each other, and a very good initiative of Sandbox, where people can come and try to integrate. People can have some pilots run, and we have many of the private players plugged in to see what they can add value, which can be used by others. And this, of course, has a big policy framework behind it, included all these policies to be done in a record time of 2 years. So NDHM presently is in phase 2, where the expansion of services is starting, and perhaps a nationwide rollout is coming in the April 2022. And in the next 3-4 years are very exciting for India, when most hospitals, most patients, most doctors, and most services will be online connected with a unique ID. That's all from my side, Priya. Thank you so much. And hope, Priya, I stuck to the timeline. Thank you.
Your timing has been perfect, Dinesh. Thank you so much. And I'm sure we'll have lots more to discuss in the discussion phase. So you've brought up some really interesting points here. Digital divide, the gray divide, fragmentation, and digital being an extension of health systems themselves. So more on that when we discuss. I'd like to now invite Dr. George Kotsatse to make his presentation. Over to you, George.
Priya, and welcome everybody. So I'll try to share my screen now. And thank you, Dr. Arora, so for your presentation, as I try to build on it, so as I go through my presentation. Before doing that, please allow me to say a couple words where I come from. So of course, I'm going to first of all speak on different level, on the governance level, while Dr. Arora presented some important elements which digital transformation would lead to and what it should include. So I want to elevate a little bit above and see what should be the role of the government in this digital transition. So I come from the country where during Soviet times, everything was regulated, government prescribed every simple thing, would that be on a data reporting part, or behavioral part. But we have seen over the course of the last 3 decades, huge transformation. and great leap. So we saw from paper-based moving to a software-based, and when we had installed software on our computers, but it was unique on each computer, and any upgrade would require like a reinstallation using the installation disks. And now we're in the world of platforms. And I specifically mentioned here cloud, because cloud is completely different thing, which has taught us to behave differently. And in this digital transformation, we have also observed these global trends and global disruptions, and COVID was the best case for probably for the digital transformations throughout the world, would that be a rich or poor. And what we're seeing now is that we live in a digital transformation where information and the data becomes factors of production. So completely rethinking the whole economics of the world, and all factors of production which we knew, now the data and the knowledge are the additional ones. We also see that there are a large number of technologies, like Dr. Aurora mentioned. There is an internet, there is a cloud computing, big data, digital technologies, and all of these transforms our societal interaction, and including in the health. And digital economy permeates all aspects of our life. So what we're doing is, as countries, probably we're lagging behind. Like if I speak about the Georgia, it was a country of Soviet country, which was governed by Soviet rules. Everything was publicly owned, publicly directed, and the government would issue the orders in order to manage the health sector. But today we're speaking about the health sector, which over the course of 3 decades transitioned to mostly private, where 85% is the private provision, where private owners and facility owners and businesses decide which technology to bring, which to deploy, how to use it. And the government is hugely lagging behind. And what used to be good enough to manage this sector, no more. So it's not going to help now moving forward. And I think it's not only Georgia, but for most governments and the global health also, that doing what used to be good enough, it's now dead. And we have to completely rethink how we deal with this digital transition, digital transformation, and which tools we will use to deal with these changes. So COVID has definitely showed us throughout the globe that there is a shift to self-care. And this transition happened, and this change and disruption happened very quickly. So we also became more used to remote consultations, and many countries probably met this challenge without having proper regulation, like Dr. Aurora mentioned that remote consultations were not legally allowed, but now they are kind of commonplace in most instances. There is also remote monitoring through different tools. We have not deployed the suite of the tools that are available, but there are some wearables which probably will be used more and more to acquire the data about our well-being, our physical exercises, and numerous other biological parameters that our bodies produce. And we now have to learn to make better use of this data, which is being hugely collected throughout the different systems, would that be in medical setting or in our households. And we have to also manage all this transition. And my points here, which I want to focus, is that, first of all, if in the past it was clear delineation line and demarcation for the governments to regulate, saying, okay, this is a health product or this is a health technology, and we just need to review it, we just need to approve it, and we do need to give the marketization permits in order to use it in a marketplace or in healthcare settings. And they had a very clear target entities whom to regulate. I think all these lines have become blurred, because with the digital transformation, we have like manufacturers that produce the watches or different tools that we wear on the wrist, and then they just generate some of the important data which could be used for healthcare purposes. We have AI developers that develop different algorithms using the huge data, and they don't necessarily belong to a healthcare setting or the industry where like government has a clear boundaries to regulate them. And and products produced by AI developers could be used by software developers to integrate the AI forecasting models into their software. And then all of this goes into a cloud service providers who are completely different, just providing the hosting side or the warehouses for this data to be managed and have nothing. And they manage and warehouse the data for health sector as well as non-health sector. So these are, in my opinion, the blurred boundaries where like different approaches are warranted. And I think business as usual would not deliver unless we change our mindset. And obvious question comes what this changing mindset should look like. I think it's impossible to individually regulate the manufacturers and producers. And I could be 1000% wrong in my assumption, but I think the first and foremost, as Dr. Arora mentioned, what are the concerns of the consumers or our patients? It's how protected their data is. And so I think establishing the laws and regulations for data protection to ensure that individual data is well protected and individual freedoms are guaranteed and nobody abuses the data would be one critical domain. By far, this is easier said than done, but like definitely as a world, as a societies, we have to think about it. We have to learn from different industries and make sure that we have a rigorous data protection acts in place. The secondly, like of the data that is being collected could be used or abused. And therefore, I think it is critical for the government to define and design which data elements have a value of public good. So they have to create the mandates on all providers, whoever collect or use the data for whatever purposes in a healthcare, and establish the mandates for reporting. And these reporting requirements by far, and we always had these mandates, we always had them in the paper-based form, and those like one can go like in South Africa and some southern parts of Africa, which we think that they are on a development path, but they used to have a very rigorous reporting forms where critical medical information was collected and reported. So even 200 years ago. So like we're used to it, but like in a digital world, we're failing behind, like not clearly saying like which data elements are mandatory by the state to be exchanged with the governments, as well as for the patients, like Dr. Arora was talking about the not availability of the complete history of a patient in one setting, and now digital transformation allowing us to achieve this, conditioned in the first position or first proposition that data protection is assured. Then also Dr. Arora said there are numerous and many countries have large number of data sets operating in silos, not delivering the value that they could deliver. So interoperability or industrial standards for data elements is probably critical, and we're probably falling far behind timely regulating this area for our for the healthcare sector and for the patients. And finally, and quite challenging task probably, like if we do manage to produce all this regulatory environment for governance purposes in order to make the huge better value out of the data, so which mechanisms do we use to reinforce these regulations and make sure that they are closely followed by those in the marketplace? And would that be public or private provider or manufacturer? So delivering a greater value to the society. I think this concludes my presentation, and over to you, Priya. Thank you.
Thank you so much, George. I mean, that was a really interesting presentation. I'm sure there'll be lots more to debate now down the line. I think, one thing that really came out is that everything is connected, and it's definitely not going to be business as usual when you're looking at this digital transformation from a governance perspective. I'd like to now invite Dr. Birger Forsberg, who to give some of his comments based on both your really, really interesting presentations. So Birger, over to you.
Thank you very much. Can you hear me well, Priya?
Yes.
Yeah, thank you, Priya. And thank you, George and Arora, for your excellent presentations. Not easy to cover all what you covered in so short presentations. Excellent. And of course, many thoughts come to mine and probably the audience minds also there. And one thing which was that they brought up and which I'm also very influenced by, I would say, both here in my Swedish work, but also when I've been out in the field, as I was fortunate to be on and off before the COVID came. And that is that we are at a stage where we have already moved so tremendously into the digital world, and so much has happened in the healthcare sector. And I'm now talking about the health system as a whole, the private, public, the alternative providers, the small drug vendors. Everywhere there's been a strong influence by the digitalization, which means there is not really a situation of going back, as I think George also alluded to. We can't start from scratch. Just to give an illustration of what I'm talking about, you can see here in the background Nepal, and I was out there in a village on the left-hand side to just look at their health post. And here you have this traditional health post with the auxiliary nurse sitting receiving patients, and she's recording everything by hand, which is then later expected to compile and put in a sheet, which will be sent by surface mail to the DHO and so on. And of course, as soon as she has looked at a patient, or when she has a break, she picks up her mobile phone and it's digital. So even at that level, which is the lowest level in the Nepali health system, and very similar to many situations in South Asia, there's a digital divide just in that situation. So there's one big challenge. I mean, how do we make the public, the government, health staff digital in reality? I mean, we could make use of her cell phone and all the other auxiliary nurses' cell phone to quickly get some reporting system in place. So here is a legal challenge. How do you manage data on people's private phones? You can't. So then the other option is provide them with government public telephones to do that. And then we got into another legal perspective, which complicate things. So this is going really from the grassroots perspective, and then going up to the highest level where you have in South Asia and in most other countries, I would say, a flourishing private sector, which is very powerful. And as we have seen over the last 20, 30 years, a tremendous growth also of very advanced healthcare. I mean, in many countries, the highest quality care is in the purely private sector. And they are ahead, I would say, generalize maybe too much, but definitely I think it's fairly true to say they are so much ahead of the government sector. So then the big question is to George and Aurora, first one. Which position should the government take here? I think, Aurora, you presented a case where the government said that, okay, we got to build the system within the government-funded system, the insurance system and so on. We start from scratch and we build up a digital system which has all the advantages and none of the disadvantages in a way. I mean, I'm exaggerating a bit, but this is kind of the ideal. And I can say from the Swedish perspective, this is what has been tried here. But as soon as you start to move in that direction, you discover, unless you already were aware of it, that the world has already advanced so much. You're going to deal with the internet, the IT companies, and they will tell you, oh, your ideas are far behind. We have this product to offer you. And another one will knock on the door and say, no, don't look at his product. We have this product. So it's extremely difficult to handle this kind of idea of starting from the scratch and building up. up a new digital system. I guess it could be done, but it requires a lot of financial resources and extremely good management, which doesn't fall in the hands of the market, so to say, the market actors, who will always seek to, of course, make the best out of the situation for them. So that's so the other position, as George mentioned, is, I mean, okay, let's take a step back and see all this is going on in the private sector. Maybe we should just focus our resources in the government sector to regulate that, try to ensure that we protect the patients from abuse and of these powerful tools that are now in the hands of many people in the world, including all of us who have a cell phone. So that's a kind of the other possibility. So that's my question to George. I mean, for my question to Aurora, would you say is a challenge for the Indian government here when we see these two different options? I would also ask Dr. George another question, which is, if we are going to put our resources in the government sector into regulating the digital market, so to say, for the benefit of patients, what would you say is a key priority, the first step, and in a way also the key priority to focus on in that process? Are those questions clear, Priya?
Yes, they are clear, and I guess we are ready to roll. So
thank you
thanks for kickstarting the discussion. And I'd like to invite Dinesh to take a shot at your first question, and then George. And of course, feel free to kind of reflect on each other's comments as well. And then I'd like to invite Jerry for the next couple of questions. We also have some great questions by the audience. So maybe once we are done with one round, we can pick and choose a couple that we can address to our panelists today. So over to you, Dinesh.
Yeah, thanks. Let me contextualize my answers and what's happening in India right now. Yes, private sector has become the dominant player, because we see that the out-of-pocket expenses is roughly about 65% in India. And though even government hospitals are free, people do prefer to go to private hospitals. And it's not only for quality, but also for time savings. And perhaps the trust in the system that, we're not sure if we go to a government hospital, you will get the treatment the same day. And so that trust angle thing is which is actually hurting the most of them. But to be fair, I believe government has a role of facilitation in this. We have seen islands of big hospitals doing some reforms on their own hands on HMIS systems within the hospitals, but then again, they're not speaking to each other. So what do you mean if a patient goes to say a bigger hospital A, B, C, and goes to down south at some other hospital, again he loses record. Who is going to build that backbone for that? Is it the private sector? I doubt. It's a public. It is a public good. It's a good more towards public good rather than private good, and I'm not sure whether the market forces will be aligned to it. So I believe the scale, the equity angle will come only with the government participation. Second answer I like to say, Birger, is that I don't believe it's a type of regulation. What government needs to do is to facilitate. And that facilitation should come from the government on those 7 things which I mentioned. And that has to be a very open-ended communication with not only with the private sector, but with the government sector also. I remember, when I was a director of Health Kerala, and we started saying, okay, let's have prescriptions written in computer. And there was a huge opposition from the doctors saying that, look, they see 120 patients in a day in the OPD in 6 hours. We don't have time to write prescriptions. There were also interests also. They want this right. They're very busy. Second, also, they didn't want to write because we asked them to write only generic medicines. And some doctors do prescribe not generic, but some particular brand medicines. So there can be audit trade also. But nevertheless, the first point is to sure that when you don't have a physical assets to back them up, when you have 120 patients to be seen in the next 3 to 4 hours, you can't burden them by asking them, give us a prescription right now on the computer, even how much stuff extra you put up there. So I believe digital access will allow them to have more time on these issues. We have now instruments coming up which can record the voice and then take it down as a printout that can go as a record in the longitudinal way. So my belief is that I agree that the technology will go forward, but government needs to play smart here. If government is not smart, they will lose out on this battle. And I also believe that it need not be always the latest technology. ICD 10, 11 came, but 10 was very good. I believe 10 is but better than many instances than 11. So it's not that good has to be the enemy of the perfect here. Government needs to put up a basic foundational structure with the 5G networks and with good internet connectivity, with a platform like ABDHM, where people can plug in their hospital and share data, whatever is relevant and whatever is asked, after they have complied with the FHIR standards. And let me tell you, because it's not a choice between government and private. I think it's both government and private. Private sector doing its own initiatives will not be able to scale up in the size of country like India with a 1.5 billion population. They cannot. They will not be able to reach it. The 500 billion is below of some kind of covered under the public health insurance. So that becomes the biggest player. In fact, what public health insurance scheme like Ayushman Bharat should do is that they should have a national exchange in them where private sector insurance can also plug in and take their claims. Economy of scale will play, accountability will play, standardization will play, and that will be the way forward. So governments need to be facilitatory, yes. Government needs to be also provide the basic, infrastructure structure. And with a country like India, with the jam trinity of, a biometric 1.2 billion cards being distributed, Aadhaar, what you call, is unique identity for every Indian. Nearly about 320 million bank accounts have been opened, almost one for every family. They have a bank account. The mobile subscription is more than 550 million in India. And so, and that, the data coverage in India, in fact, is more than China. It's about 8 gigabytes every month we use mobile data as compared to 5 in China, and as good as an advanced digital economy like Korea. So I foresee that country sizes like India has a huge scope, and there have been some great steps in that direction. It needs to also incentivize the private sector to come on their platform. They are building up a great platform, but they will need to have an incentivize because the bigger hospitals are already working on some kind of platform. To bring them on this platform, which is FHIR compliant or ABDHM compliant, will require a second wave of incentivization, as well also a dialogue with the public health sector to also bring them on that platform. But very much doable according to me. Thank you.
Thanks, Dinesh. And maybe we could get George to kind of address his question from Birger. And Birger, you have your hand up, so please feel free to interject.
No.
I will do my best, what should be the first where the government should start. And I also try to answer probably in part some of the questions that were raised in a Q&A box. So I think what is critical, and Dr. Dinesh also already spoke to many things. So before I start answering, let me say, so I don't believe that there is a public and private when we talk about the digitalization. So I think the rules of the game should be same for public and private and should be applied across the jurisdiction. So would it be private provider or would it be public provider? Probably we'll have to learn that there should be a one rule for all related to digital data generation, sharing, and use. The second, I believe that data where the concerns of ownership and privacy comes into a game, that's related to a patient level. And I'm not a strong believer of kind of completely redesigning or reshuffling everything, because I think we have to adjust the current systems to new realities. And first of all, like in the old days where the data belonged was that data about the patient was always owned by a health care facility where the care was provided. And if successful systems were established, there was also a specific format how the data was shared between one level of care to another. So now what digital transformation has accelerated is data exchange. Instead of putting in an envelope and sending it via mail, so now it could be accessed, but the right to access or not to access probably belongs to the patient. So the system has to be designed where ownership of a data is clearly defined and nobody has the right to infringe these ownership rights, and those ownership rights should rest with the patient. And then patient decides to which facility allowed to access the data of past history or not. Thirdly, I think all the data that is being generated after it's anonymized, meaning like after the privacy is kept with the patient, the rest of the data where we don't have the patient's name, we don't have the patient's residence, exact residence, I mean an exact address. So that it could be and serve the public good, and should be analyzed as we do with the statistics and as we have been doing for 100 years, analyze the statistics and use it for future. So, but in order to make sense of this data, so the standards, like Dr. Dinesh was saying, are important. Like the world has been trading internationally for so long, and we don't have the problem tracking down how much timber was sold by India to China or the vice versa, or what the goods were sold. So there is a classification of the goods and services as well. So that have been long been classified and collected through the customs data, and so that the global world has been monitoring the international trade for so many decades. We have succeeded in classifying the diseases, but probably we have failed yet to standardize the interventions. We have the numerous classificators, but they are not sufficient. So we have failed to standardize and classify, for example, types of providers that health systems might use. So what we're lacking in a digital world, and that's where the global as well as the national governments have to come together and define the standards for classifying certain important things which we have been doing so far. We just lack the standard classification for that, which is the catalog of interventions or type of providers that Dr. Dinesh mentioned. So I think like defining the ownership rights and developing these catalogs are the first essential important steps to allow that the systems to evolve, develop, while the governments are dealing with other areas that I have mentioned.
I mean, I wonder, this is Jerry speaking. I mean, you've both laid out really very well some of the key opportunities and some of the challenges, and talked in general about the role of government. But in both countries, how do you see what capacity does government need to develop to be effective in this new environment? Where is this capacity going to sit? And how can governments prepare themselves? Because in a way, both of you have worked in very practical ways with governments, and it would be good to get your thoughts on how governments can build up this capacity. I wonder if Dinesh has,
Okay, let me start. So, I think on a digital side, the capacity, at least in my tiny country, which would be a village probably for India, is already there, because in terms of digitalization, Georgia is well ahead. So, for example, we have a genuine like public register where all citizens are registered and have unique identifiers. And with this number, you can get so many government funded and supported services. So developing the digital aspect is not a problem, in my personal opinion. What we're lacking first the standards. I think the world would be much better place if WHO as a normative agency takes the lead on this with other peer institutions, because they have many in Geneva from whom they could learn, and set the standards, meaning like give us the unique classification like they gave ICD-9, ICD-10, now 11, as well as like the work on the intervention standards, which are already there, and set the norms and standards. That will be a huge help for the government then to borrow and introduce in their jurisdictions. So that would be probably, rather than governments doing this on their own, it would be good if WHO does this as a normative agency for the standards and classifications. And these standards include like data format standards for interoperability and etc. With regards to ownership right, because that's purely like a social, like culturally specific probably, or country specific, I would say, and very context specific, I think there should be a deliberation. But what we're lacking right now, we're lacking the templates or samples for the parliamentarians or legislators to go and see like how this or that country has dealt. I think there is a fair bit of discussion that has to occur between the countries. Not sure if this should be on a global or it should be on a regional level, but definitely like peer learning is warranted here in order to clearly define what the provisions of data protection and ownership rights should be in the legislation for the country. And for that, I think it's more of a discussion and debate rather than just sitting in a given country and deciding like how to deal with this. Thank you.
Thanks. Let me also attempt, I think, spot on, George, on your views. I fully echo. Let me show a slide here because I think India is a bit behind in what we will actually. Okay, I think this one should do. Is my screen visible?
Yes,
Clear.
yes.
So this is the,
It is.
this is the stack we call India stack, and the health stack is built over it. And George is right that the country may be more advanced. Even we in India, and I've seen questions also coming that we are not even very liberal on data, and data sharing is not as exactly as should have been. So while we right now are on JAM, so JAM is basically Jan Dhan accounts, that's the bank accounts. Aadhaar is the unique identity. M is the mobile. That's called JAM Trinity. And we have an India stack of UPI, DigiLockers, electronic signatures, all being now built up. So that's a backbone structure is laid up. Now we need to build up a health data exchange layer where information from electronic registries of the public health professionals, health ID of an individual, which we call now as Aadhaar, a health facility, drug registries, then the health records. And we believe, and so as that the owner of this health records should be the individual, and then they can be shared based on the consent. And then for insurance, the health claims may be on the e-claim platform with a very interoperability markup language for everyone. And over this health data exchange layer could be built up different services, whether it's telemedicine, book your appointments, book your labs, book your ambulances, see which hospital is available, which doctors are available. So that all will be available over the click of an app or on the internet. And beyond this can be any more private sector interventions coming and making it more simpler than. So for example, any telemedicine built on India stack, they will be ensured that, well, this health ID of the individual is right, this doctor is right, they know this doctor's health registry ID, so it can be more genuine encounters between them. So I believe that governments has now come up with a plan, and they are in the implementation phase of the health data exchange, and over which unified health interface services can be built up. But I fully agree, two things are important here. The unified standards. We talk about cities, we talk about hospitals, we talk about states, we talk about countries. I think George is right when we say WHO should come up with a lead the way on the digital health standards on this issue. I stop here. Thank you.
I wonder if I could come back to Dr. Arora, though. As India embarks on it, how big a team do you have to implement this? And what are the lessons about what skills, is this a team where does it sit in government? Is it in the Ministry of Health? Should it be in the Ministry of Telecommunications? What kind of skills does it need? Because you've said government is key to equity and to other things, but how can government have that capacity? And how does it build it?
Okay, my views are personal here. 1, 2, I'm no longer the deputy CEO right now. I'm right now doing my sabbatical with Johns Hopkins University. But just wanted to share that we got the Prime Minister's approval to house it outside Ministry of Health, and this became a national health authority, and headed by there was an executive body which was headed by the health minister and representative from Planning Commission, Niti Aayog, Ministry of Health, Ministry of Finance and Health. This was kept at an arm's distance from Ministry of Health for 2 reasons. That we wanted to have a provider-payer separation also, because Health Ministry is a supplier of services. It's a public supplier of services, and we didn't want them to influence. As I think Birger also mentioned, or George also mentioned, that we are agnostic of public and private sectors. Our job is to provide a flat platform where public and private sector both can plug in and use those services. Our rates, our facilities are equivalent to both public and private. Whatever we charge from public, we would be charged same from the private sector. So this was a challenging affair when we started from scratch. We were largely supported by by Ministry of Health, but Niti Aayog was very, very, upfront, and we got a very exclusively from a very seasoned person as a Director General, who was a former Director General in ADB as our CEO of this mission. Now the CEO is also a very seasoned person who's an expert on the IT, who was actually himself had pioneered Aadhaar during his own time. So I fully agree that this has to be a mix of IT and health skills. Primarily IT, but backed by a solid health. So it could be like when I was a deputy CEO, I'm a physician, public health expert. So I brought in the skills of a health, and the IT skills were brought up by the CEO himself. And we had different teams. The Ayushman Bharat website, you can see now the teams are pretty big. We started from a small 2 rooms in ministry to today we own 5 floors on a health mission in this Connaught Place. So that's the beautiful journey. I think some of the time I'll share how those experiences were, but yes, they were not easy. We had differences of opinions with the Ministry of Health. Thankfully, this body, with the direct intervention of the Prime Minister's office and Niti Aayog, we prevailed. But it was all eventually for the good. Discussions were good, whether we should have a federated IT system or it should be a one IT system. How do we manage them? How do they do state-wise things? So there were a lot of discussions, but huge learning lesson. The learning lesson is actually that get the best practices out. We saw Taiwanese model. We saw South Korean models of IT health infrastructure, and then contextualize in India's context. Talk upfront to the states, to the different stakeholders, including drug manufacturers, including hospitals, private, public. Bring them on board and then move forward. That was a philosophy. Thanks.
I know there are a number of other questions, but I don't know, Priya, if it'd be good if either George or Birger want to make a brief comment on, in a sense, the question is, what does government need to do to stay effective in this new environment?
And actually, Jerry, I might just add to that because we've got some really great questions from the audience, and it kind of tacks on to that. So I'll just, so I think this question I'd like to actually pose to George, and Dinesh, please feel free to answer it. It's from Dr. Jayesh Sridhar. And she says, have there any large-scale values, needs, and preference surveys been done among private health users to assess their views on the benefits of digital health interventions vis-a-vis data privacy concerns? So, from the Georgian, as a Georgian example, do you have any examples where, you've actually undertaken surveys that can actually inform private and public sector about the benefits of digitization and health? And there's another really nice question that's come up, and there are lots, but I'll just probably just put this forward really quickly. It's from Kirsten, and she actually talks a little bit about global health data governance, and she says that Transform Health has been working with many partners to steward the development of a set of principles. And basically, she wants to talk about whether data governance can be underpinned by equity and rights-based principles, and how does this relate to kind of digital integration? I hope I've got my question right, Kirsten. So I'll probably put this to Dinesh. So George, you first. Has there been any examples in Georgia of evidence pointing to digital beneficiaries, and how can this be used to actually build trust for digital transformations?
So that's probably $1 billion question. So let me start a little bit unpacking it, because I will premise my response with Steve Jobs was suggested to do the survey, how people will use the iTunes. And he said they have not seen it. How would they know they want iTunes or not? So when we say surveys of people's preferences about digital, and the digital we're just crowding many different things, and probably we could speak about the product specific surveys, and of course which is helpful, that many apps that have been launched, many platforms, government owned or privately owned platforms that have been launched, they do collect consumer experience or patient experience, and they do get the feedback very easily, so how to change or modify. But that always relates to a specific product, specific app or specific platform. And just doing the acceptance of the large digital transformation and how population feels about that, that's not even seems feasible to me. But for specific ones, yes, they have been done, and therefore, like based on consumer feedback, so some adjustments have been made or have not been made, and they have been completely ignored. So we live in a developing world. So the second issue is like the concern of the public, and there is one also important question about the trust into the government systems to hand over this data. So a very important thing, but it goes far beyond the digital health issues, and it's kind of the trust in the governments in general, because we're on a daily basis giving to our governments huge digital information about ourselves and how much we trust them or don't trust. So this is a huge question for which I'm not prepared to answer, but definitely I know that this is not only related to the healthcare data, because my government has the data of all my properties, all my bank accounts, all my personal IDs, what I have done, how many times I've crossed the border, where I have gone, which flights I have taken. So there is so much that concerns me about how much government knows about me that it's not only health, but health would be just one element, and this is a beyond health data governance. It's just a digital data governance, and probably the world and the similar concerns are kind of resonating in other countries as well, and other friends that I have in other jurisdictions also are concerned with the similar issues. So we as a society have to deal with these issues globally, probably. So what was the final question about this?
So it was whether, any
global
surveys.
Data governance, global data governance. So health-related data as we speak, has been long collected by WHO, but they collect the statistical information. They don't collect the individual ones. Also, these data systems have been evolving gradually, but the problem is that they have been also evolving sporadically. So I have been, I'm not going to, I have been affiliated to one of the global institutions, global health institutions. So, and I have seen how much additional demand they have placed, just taking only their institutional views, following the donor requests, and imposing huge compliance cost to the governments to report, or the government national programs to report new data elements disaggregated in the different forms. And at times, very little consideration was given to a country context and country's ability. So I don't know, and I frequently get lost when we talk about the global health data governance, unless we speak the norm setting, standard setting on a global level, taking it through World Health Assembly, as one of the participants have asked. Definitely, I agree that global governance for me is defining what is important for the global world, to be reported internationally. Secondly, defining what the standards and norms should be, and also helping the countries to establish the standards through which they will be compliant to global requirements. So that's how I would respond, unless I completely missed the question. Thank you.
Okay, great. Thanks, George. And I'd like to kind of move that on to Dinesh as well, because we were talking a little bit about this whole role of equity in health. And in fact, there's a follow-on question that Nadira Sultana from Bangladesh is also asking, where she says, demand side is crucial to participate in digital health along with supply side, but there's always a gap between demand and supply. How would it be possible to install a better alignment between demand and supply where digital health is concerned in resource-poor settings in Bangladesh, in countries like Bangladesh as well as India? So so Dinesh, how do you think this can be addressed?
Thanks, Priya. Let me answer both the questions in a small anecdotal way. Well, leave aside, India won't have any digital service so far because we're just getting into the digital era for health. So that may not be suitable for India, but let's understand what could be the best scenario for India. Suppose I have a vomiting at 2 o'clock in the morning when I was sleeping, right? What should I do? if it was a digital seamless wave between physical and digital systems, I should be able to call a helpline. The helpline connects me and says, okay, sir, did you have a fever? Did you have blood pressure rise? Can you check your blood pressure and give us a value? If that's possible, then if it could be a nurse, it could be a nurse practitioner to handle that call for me at 2 o'clock in the morning. And if she feels that it could be a warning sign for something coming up more. If the blood pressure was very high, immediately she connects me to a doctor or a specialist. The specialist gives me a medicine immediately to get my blood pressure down and says, okay, sir, next tomorrow your appointment has been fixed with this hospital at 10 o'clock. Please move there. If you require an ambulance will be there. If in next half an hour you feel further discomfort, please, ambulance will be at your doorsteps. We have got the GPS identity through your call and we'll be there. So that's a seamless best case scenario for me in coming few years if it happens like that way. Now, considering whether people will be balked about their data, well, George was saying government has control of all, and that's true. But we have Aadhaar, we have PAN, and the government knows everything here, right? Also, but I'm sure Google knows more than government, right? So I remember I just on my Google app I just said, look, I'm putting on weight. So what are the weight reduction techniques to do? And you won't believe it. And whatever I used to Google for next 1 week, my weight reduction advertisements were coming every time on my screen. Thankfully, I was just checking on the weight reduction things. But just imagine that I think we will have to live with the digital era of an AI era, which we should. But I believe the cost benefit ratio benefits are much ahead of anything in the cost for having a digital era, being embraced by the countries, notwithstanding that it should be ethical, notwithstanding it should be aligned. Equity, of course, it goes without saying, but technology itself is agnostic, whether to public sector, to the private sector, the demand side to the supply side. So what do you mean by supply side? Supply side means somebody is providing services to you. That's namely the government, public sector. Demand side, when it's like a health insurance scheme where you say that you have in your wallet this much amount of money, you can buy your health services from anyone, public or private. Technology is agnostic. In fact, the better the platform, more private players will rope in that technology. They will use it if they have a system which is open sourced, which is interoperable without any mistrust between the public and private. That will become much more. Equity, I think I will see, as I explained also in my slides, on two accounts: digital literacy, and second is the gray literacy, the gray divide, where seniors may require some hand holding. They may not be in a situation to learn the digital techniques, and I think that we will have to have it. But on the other side, I think it should be part of the curriculum anymore now. Two things, if given a choice to me, is one is on digital literacy and second is on financial literacy, where our kids should be actually should be taught from the day 4 or 5 of the classes and all that. Thanks.
Great. Thanks, Dinesh. Jerry, any questions from your side? You have to unmute.
Okay, you've opened up a lot of challenges. Where does the general population fit in? How can citizens be involved in some of the decisions made about the future of digital health and the regulation? Or is this mainly an issue for government and the private companies?
Yeah, that's an issue, I think. As far as NHA is concerned, National Health Authority is concerned in India, every policy was put on the website and asked for the comments. But I fully agree, how many people watch websites and how many people will comment on this? So it will be again left to activists, and will left to some of the private companies to speak and inform citizens. So that is a challenge, in spite of going out in the local language, in spite of coming out with different on the radios for asking your comments and all. That will remain a challenge. I think it has to be a more mature democracies to come over to have a discussion on these things, because that's, I think, one which we need to work more on. That's what I can say. Thanks. Very pertinent question, George. I can't agree less than that. Gerald, thanks.
George, you want to take a shot at this question? Just unmute yourself. Yeah.
I think like Jerry's question still implies this private part of it, not implies, but he mentioned the private. And as I've said, for me, like it should be completely irrelevant. Is it private or public? So it's about like government serving the society. So therefore, considering the societal views whenever they engage with private or public. Like problem is like if we just start dichotomizing and saying, oh, you need these steps to be taken if you deal with the private, but if you do it for the public, you're not required to do that. That's not true. So anything that is being done should be done for the universe of private and public together. So, and not in a siloed approach. Unless I've missed the point that Jerry, you were raising. So
it's more practically how. How are we going to engage the public? Because it's right now the discussion has been very much about what does government do, what does
I think like
private sector do, but where are the citizens in this discussion?
Okay, let me follow like and a little bit unpack this public in my personal opinion. So if I'm doing something and putting some requirements on the providers of the primary healthcare, I was just responding to one of the questions about the primary healthcare integration. So unless I go and speak to the primary care providers and speak in urban locations, in rural locations, I understand their challenges. I understand their infrastructure or context they operate. So I should not be setting the standards that would never be met by the rural primary healthcare provider with a deficient infrastructure or capabilities. So this is for me the engaging of a public, and in this case, primary care providers and their community. If I'm doing something and setting the mandates for a hospital level, then I go and speak to the community of hospital care providers. Now, then we speak about the public in general, citizens. I think the citizenry involvement is through this consultative process when we define the ownership rights of the data exchange rights, what is feasible, what is not feasible, not to cause the digital divide, not to cause the gray divide. Obviously, some divides would always remain there and eventually would evaporate as new generation come in. Like, for example, for family planning, it took a generational change in Georgia to change the use of the family planning devices, and we constantly failed always with older age. I'm not saying that this is true for everything, but sometimes it's given. So you have to allow for this generational change for some things to be put at scale, but there are some others that could be done. So this is my response to how you engage the communities, and it depends on a topic and issue, and then modality like through which you engage them.
Great, thanks. Birger, any thoughts or any comments or questions from your end?
Yeah, no, thanks. I just put in, now it's done. Yeah, I just say that it's reversed the picture. But anyway, I just wanted to come back to a point there that I made initially, that we are also forced, I mean, we need to think of the day-to-day activities out in the field, the grassroots health workers, and in this case, you see a picture of private providers in an Indian state. How on earth, if I may exaggerate a bit, are we going to get them incentivized? And Dinesh, you said the role of the government is to facilitate for the private sector to join in and so on. That's a tall order, and I think surely it can be done, and they will move in, but gradually. But we need to think of the fact that it's for India. I mean, it's a huge market we're talking about, and it's difficult to get them all in, of course. But all right, in the end, we'll get there. Thank you.
Yes, Dinesh. Yes, go ahead.
I'm a little more optimistic than you here. I agree, it's a challenge, but then everything works when you have challenges, and you can incentivize. Why can't government give them some more OPD consultation, the package which involves OPD consultation. So if you shift from a non-digital health compliant to a compliant system, you will get 10% extra on every patient you get out of the insurance money. So that works. It's a matter of policy decision. It's a matter of accountability. But see the benefits which people get there. If a doctor is on, so I was very clearly watching the board because I was just trying to understand if he's not a quack, if he's really an orthopedician or is somebody who has said that I'm an Ayurvedic doctor and coming and writing himself as an orthopedician. So I said Ayurvedic because there are different streams, equally respectable. But just wanted to ensure this. So what will this bring in? If a doctor is registered on a national health ID with his registry done, patients will be secure that this doctor is a genuine practitioner who is recognized by the system, and he is part of the chain where they can claim their reimbursement. So it will be a paperless, seamless, cashless interaction with that doctor. And that's good enough to have their doctors incentivized. Birger, I think we can have another session after 2 hours and I'll show you the records, how many doctors have registered themselves on this. I believe it's the right incentivization alignment which will work here. Nothing else will work. No amount of regulation will work. No amount of laws will work. But if the felt need, if people start saying that, we wanted a doctor who already registered there. We have many private sites like Practo and all which do telemedicine, but I'm still not sure who's the person on the other side. This will ensure a telemedicine backed by a digital health mission in NHA is an authentic one because we have verified that this doctor is an orthopedician. These are his credentials. Maybe in coming time we'll have rankings also for them. So I'm very optimistic about this. It will take time because it is a huge country. It will happen.
Great.
Thank you.
Dinesh, we're almost up to time, Jerry. We have about another 2 or 3 minutes. So any thoughts or comments from your side that
Sure.
we could kind of, as one last short round of questions? Yeah.
Yes, I think we should admit that this series has been organized by people from the research community. And I noticed George's first slide, he said that a key issue now is management of change. Well, change can move towards good things and it can have unexpected consequences. And I guess I would be very interested in comments from all three, including Birger, on what does this digital transformation, what new responsibilities does this create for the research community? And how can they be more effective in supporting a transition in a desirable direction?
Yes.
Well,
yes, George.
Let's start, Terry. So I think this this legacy that we still retain, like public and private, there are many dimensions why we do that, and there are many good reasons why we do that. But I think the first thing we have to there is plenty of evidence showing that even the places where we thought that the public was the main provider of the healthcare services, we see that essential services such as maternal child care is being provided by private providers. And luckily, now we have a lot of evidence proving that has been true. So we think probably through this dimension because we think it's easier to deal with the public sector because you can direct them, you can send them an orders and etc. While with the private sector, it requires, as Dinesh said, so it requires incentivization and partnership rather than directive. So what the first thing probably the research community should do is stop talking about this dichotomy. Yes, always look and evaluate the things, but don't keep private sector in a different bucket. They're delivering the services. We have to learn how to live together. So as a research community, not as a society, because patients are already going there. So that will be my first and foremost thing that I would say. Thank you.
Great, thanks, George. Dinesh, would you like to come in? What can the role of research and objective evidence do to kind of bridge some of these gaps that are emerging?
Well, I have been a practitioner for 20 years, and for the last few years, I have only worn my academic hat. So difficult to still come out of a practitioner then, but I feel data is a key here. And coming from India, where I can see some of the comments, and I think some are directly asking me about the data sharing even at Ayushman Bharat. So like we need to be more liberal on data, and that's the first thing before any research, authentic research can take place. I have been 3 days back, I was in a UISPF conference. They were talking about immunization for adults, pneumococcal, herpes zoster. And my only query was, where is a randomized control trial from India? And their answer back was, where is the data sharing from government? Why doesn't the government share data to us to do research? So all our researches are basically based on the Western world. And that's where I believe this wave of digital technologies, waving wave for a digital data, big data, and if our incentives are clearly defined, we'll have a huge scope of research within India. The data actually are generated a huge number, and with a well-defined policy, perhaps this will be the key area where we should have more evidence-based research done and decisions taken. Thanks.
Thank you, Dinesh. Birger.
Yeah, I think research here can be seen as a term for the systematic study by mankind of evidence and progress. So what we were doing in research is that we pick up things from observations that are kind of random or coincidental and so on, and then we try to see, is that a phenomenon which is stable, what are its effects and so on, and then to verify that this is really a truth in a way, and it's not only a random observation. So for sure, there's an endless number of tasks for researchers in this field. I mean, just take the example I started with this auxiliary sitting out there with a cell phone and the parallel system. I mean, if we would like to, it seems like when you're out there, you seem so obvious. Why don't we put these two together? But then the question is, how do we do that in what is also a complex system? All systems are complex. A village is complicated, and so that's where research could come in and evaluate, I mean, a possible intervention and so on. So we have to do that all the time. And I think we are doing far too little research on this very, very important field. Because in South Asia, as you said, Dinesh, I mean, 65, or I used to say 80% of children are first taken to a private provider when they fall ill by their parents. So this is a huge challenge. And I showed you a picture of what the real world is like for many people out in towns and villages in India, also Nepal. So yes, research for sure. Let's go for it. Thank you.
Great, thanks, Birger. Jerry, any last summing up from you before I share the closing remarks?
Well, well, sure. I mean, I think the presentations were excellent. And I think what they did very well is present a sense of the possibilities. I think the challenge I'm hearing in both countries really is, how does government, and for that matter, the private sector and the health service, learn the skills to manage the next steps in a transition? Because although we can see a target many years down the line, actually what will determine the direction of change is how we manage the process. And I think, to me, the big lesson is that there are great possibilities. There are also risks. And this requires really now committed effort to learn how to make this work well and how to avoid the big problems. So I think this is a great step forward in pointing in the direction, but there are a lot of practical issues to be solved by working together.
Thanks. And I agree with you, Jerry. I think what this forum really brought about were some really key issues that are bubbling to the surface, even as we begin to look at how digitization can achieve greater access and improved quality for the health outcomes, not only for today, but more importantly for tomorrow. We've heard about impending digital divides, addressing of the gray divide, of digital health being more intuitive and more equitable in terms of design to kind of reach the last mile. We've talked about the vagaries of fragmentation and how that can actually be pulled together, and that government can play a very important role in pulling together very diverse providers. We've talked about digital as a part of health systems and as an extension of health systems. But more importantly, as George says, we've also talked about the need of researchers to look at different kinds of data and maybe begin to learn with the enormous data, administrative data that governments often have to deal with when they have to make decisions around capacity and system strengthening. So I think this is a clarion call for us in the research world as well as in the practice world to come together, perhaps to evolve a new type of thinking about how the future is going to look like, because for me, it definitely looks fairly digital. So thank you so much. And it's been a fantastic session. For those, there have been quite a few really wonderful questions. And if you've not been able to answer them directly, what we'll do is we'll send them across to George and Dinesh and Birger, and we can, then have the answers put up at our website at www.innovationforuhc.com, and we'll send this out to you. We have your details via registration, so we can also send some of the replies via email. Again, thank you so much. I'd really like to extend a very warm thank you to Dr. Dinesh Arora, Dr. George Kotsatse, Dr. Birger Forsberg, and thank you, Jerry. It's been such a pleasure to host you all and really look forward to keeping this conversation alive in the future. Thank you again.
Thank you, and thank you, Birger, for those wonderful backgrounds. Birger, thank you so much for the wonderful backgrounds. Amazing.
Thank you very much. Yes, optimism, Dinesh, optimism. Thank you all.
Absolutely.
Thank you.
Thank you.
Take care.